Hello, thank you for inviting me to this World Young Scientists Summit to share our experience on telemedicine to maximize eye care. Today, there's a huge population which has almost 253 million people are visually impaired. Of this, 80% can be easily preventable, and most of it is unnecessary. A simple cataract surgery can make almost 7.5 million people see, and a pair of spectacles will make another large population to see better. Even this is not available to many people. So what's happening? There are people who come to see us, and then there are those who seek care elsewhere. But there's a large chunk of people who don't seek care, but they do need it. So how to reach to these people? So at Arvind, we always were designing our whole system for what we call as non-customers who do not reach out to us. And for this, we use the eye cams, which is the essential mean to reach them. These are where a team of doctors and nurses go into the community to screen the population for their eye problems, including refraction, give them prescribed glasses, medicines as needed, and those needed for cataract surgery are brought to the base hospital, operated and sent back. In spite of these massive efforts, we realized that we were reaching only 7% of those who actually need eye care. So there must be something much better. How to reach everyone who need this care, especially when we have to reach them early enough in some of the diseases like diabetic retinopathy and glaucoma. There is this technology is one path which we can take. We have been trying to use this because today technology is available in every part of the world, more so in India. Even the rural villages are well connected with technology. Even they may not have roads, but then there are cell phones available in all these vision centers. So we have been using this for the last almost 16 years to reach these people using technology. We divide them into primary eye care and then secondary eye care. At the primary level, we started what we call as vision centers. These are transiting from the camp or outreach programs, which are permanent facilities. These are permanent facilities available in the local remote areas, which covers a population of 50,000 to 75,000. This functions every day like a hospital. It is equipped to provide comprehensive eye examination, where this place is staffed by trained ophthalmic technicians, and they are used for first aid emergencies and also provides primary eye care and referral services. These ophthalmic technicians would examine the patient just like how a doctor would do in the base hospital. Patients would get registered, a complete eye examination is done for them, and their entire data is entered into an electronic medical record. Then they are connected to an ophthalmologist in the base hospital using telemedicine, where the doctor is able to look at all the patient data, including images, and then advises the patient on further management. If the patient needs glasses, it's prescribed right there in the vision center itself, or some medicines. Otherwise, they are referred to the base hospital. Here you can see a technician examining a patient, including applanation tonometry. She's taking simple fundus photographs, and then she connects to the doctor at the base hospital, where the doctor is able to advise the patient on further management. You'd be surprised to see that only 10% of the patients actually need to be referred to the base hospital, and 90% of these patients are taken care of using this telemedicine technique. It's as simple as prescribing glasses or some medicines. Today, we have about 94 vision centers. For each of our tertiary hospital, we have quite a few. In the place where I'm located in Madurai, we have about 30 vision centers. It's like a hub and spoke model, where all these vision centers are connected to the base hospital, where the ophthalmologist sitting in the base hospital is able to manage about 5 or 6 of these vision centers. Today, we are seeing almost 2,800 patients consultations every single day. Today, we have about 94 vision centers in the southern part of India. It's seen that this is the best last mile connectivity in any eye healthcare intervention and gives access to eye care for all. Since it's locally available, more patients are accessing care and there is no dependence on any attender. There's a lot of time and money saved and compliance to care is much better. So if you see the impact of these vision centers, it's really huge. Today, we have seen that even for chronic diseases like glaucoma and diabetes, it is able to reach a larger population of patients who have glaucoma or diabetic retinopathy in those areas, including refractive errors or those who need cataract surgery. No other last mile intervention seems to have reached so many people other than these vision centers. And another important thing that we noticed, especially these post-lockdown period, is that these primary eye care centers are the first place where most of the patients reached. If you look at the patient volume after the first lockdown, we saw that the primary eye care centers almost reached 66% in a very short period of time, while large tertiary centers reach only 11% of their pre-lockdown volume of patients. So this has become a very role model, and many state governments in India and even in Bangladesh are replicating this model. In Bangladesh, they are replicating about 400 vision centers. They've already established 90 telemedicine-enabled vision centers, which we have been instrumental in setting up. There are also in many places, the optometrists are trying to provide eye care using these telemedicine facility and using this as a referral services for areas where there are no ophthalmologists available. So this is not only for primary care, but in other areas, like one of the major problem is in diabetes, where you need to screen these all diabetic patients for the problem of diabetic retinopathy. So today in India, we have a huge population of about 77 million diabetics. This is only the diagnosed diabetes. There's the equal number of population we suspect who have not been diagnosed. And with this, the problem of diabetic retinopathy is also very high. So how is it possible to screen all these diabetics even before they lose their vision? Telescreening is one way to do it. We have been using this technology to link with the physicians, because physicians or the diabetologists are the first point of contact for the diabetic patients. They would go there for their diabetic examination, and we use this opportunity to screen these diabetic patients at the diabetic clinic itself. So using telescreening, we placed fundus cameras in the diabetic clinics where their technician takes a fundus image, sends it to the base hospital or our tertiary hospital or eye hospital through the internet. The image is graded by an ophthalmologist or retina specialist who grades these images, generates a report and sends it back to the diabetic clinic. Then the patient is counseled. Only if they have any retinopathy, they are referred to the to the ophthalmologist. And this whole process takes about 1 to 2 hours. We also use in the primary health centers where patients come to collect their diabetic medicines. We ensure that every single patient, because who come for collecting the medicine, get their eye examination done. So this way, every single diabetics are screened. With the advent of artificial intelligence, this has become much easier. We do not need to depend on the retina specialist to do the screening. Today, we are able to use this Google-developed AI algorithm to generate a report within a minute, and then the patient is the counselor at the diabetic clinic is able to advise the patient on further steps or refer the patient if needed. So this has become much better with when we evaluated the performance of artificial intelligence against a trained ophthalmic grader or a general ophthalmologist. They were as good as even a retina specialist in most instances. So today we are using AI in real time to screen all diabetic patients in most of our vision centers, and in some of the diabetic clinics, we are screening these patients using AI so that these patients can be identified early. So telescreening can help in increasing the access to eye care. Early identification of conditions like diabetic retinopathy, glaucoma, AMD, corneal ulcers, refractive errors are very important, and this will prevent needless blindness that can occur. So this also addresses the problem of scarcity of specialized resources such as ophthalmologists in these remote locations. And the use of AI in telescreening will make even unskilled workers to triage patients for referring to the ophthalmologist, so that the ophthalmologist can focus only on their area of expertise. So I want to thank you again for giving me this opportunity. Thank you.